welcome to another episode of the Community Health and Capsules podcast. It's been a little while since the last podcast, I think, wasn't it?
Indeed.
Sorry, everybody. This is Matt, one of our co-directors on Health Kick.
Hi.
I'm Johnny Curry, and we're joined here today with Dr. Lisa, GP, person of many roles, but here to talk to us today about lifestyle medicine. Hi, Lisa.
Brilliant. Thank you for having me.
Thanks for joining us in our first ever podcast in the podcast studio. Thanks to Dan Harris from our partnership board for hosting us. Just tell us about lifestyle medicine then, Lisa, and what made you get into it?
So lifestyle medicine is a evidence-based field of medicine. So it's not alternative medicine or complementary medicine. It's an evidence-based field of medicine where we look at the 6 pillars of lifestyle medicine, which are universal across the world, which are sleep, healthy eating, movement, social relationships, minimizing harmful behaviors, and mental well-being. So if you balance those 6 pillars, then you can reverse lots of the lifestyle related diseases that we see these days. So as GPs, 80% of what we see can be associated with lifestyle factors.
Yeah.
So that's a huge amount of the stuff that we see, which these 6 pillars can make a real difference and reverse a lot of these diseases without needing to depend on as many medicines as we currently prescribe. And not only that, but it can actually make people feel better. Because, how many times have you prescribed a medicine where people really do feel much better on it?
Yeah.
Like, we can see the numbers being better, but they don't necessarily come back saying, God, I feel like a new person.
Yeah.
Whereas lifestyle medicine does do that. And not only does that to this person, but if they feel better because they've really been really successful, they share that with everyone. It snowballs. But they don't go around down the street going, oh, I've been prescribed this cholesterol tablet, I feel brilliant, you should go and ask for it as well. But if they say, oh, this doctor told me to do this and I feel so much better, they're going to share it with their friend.
Nice.
So it's a massive opportunity for us as primary care clinicians, when we're so pressured, to help people to actually feel better and feel empowered in their own healthcare.
Well, that's a good strong sell, isn't it, Lisa? You're a proud,
super
passionate supporter. When did this journey start for you then?
So there is the British Society of Lifestyle Medicine. So that's kind of the society that helps to educate health professionals in this field, like sharing the evidence and training us. They've been around since 2016. So that's when they started. But it was actually when my daughter was born in 2014. So she was born with neurofibromatosis, which is a genetic condition which causes tumours on nerves, and she developed it out of the blue, so it's not in our family. And as you know, it increases your risk of everything, all types of chronic health conditions, and multiple cancers. So obviously, as a mum, I was absolutely terrified, and there's no cure for it. It's quite rare. There's not loads of money that goes into it to think, oh, there's a cure anytime in the near future. So I had to find something to minimise her risk of developing these kind of potential consequences.
Sure.
So I obviously went into full medic/terrified mum mode, and I was researching all night long, just going through so many medical journals and trying to find anything out there. And that's when I came across the field of lifestyle medicine and how actually doing this, it is associated with less risk. And the field of epigenetics. So, you can be dealt cards, but it's your lifestyle that tells you how to play them. So that's the most important thing, is having the skills to, despite what genes you've been given in your family line, what can you do to try and support your body to not express your genes in the wrong way, and how do you help your body to be able to take care of itself? Because our bodies are designed to help themselves and heal and repair. What can we do to increase the chance that we're staying in that mode? So you're going to be highly motivated, aren't you, if you've got a little baby who you think, oh God, I don't want her to have risk of this cancer, that cancer, and you always think the worst, don't you? So I had high motivation to change things, and people do change from desperation or inspiration, don't they? And I was absolutely desperate. So just when I was looking through it, I just thought, God, this is more than preventative health. This is putting it into practice. And like I changed like everything at home. So we looked at our food, our sleep, meditation for her as well. So as you know, she was then having like lots of these MRI scans and had to have them with general anaesthetic, and obviously like when she's having general anaesthetic, I was like, oh, she could die from this general anaesthetic. So I started doing meditation first for my sanity,
to cope with it.
Because I was like so pressured then, and it just made me feel better. And then started doing it with her, and then she could lie in an MRI scanner for an hour and a half without anaesthetic at 4. So they were like, oh, we've never seen a 4-year-old stay still for an hour and a half before.
That's amazing.
So it just made a massive difference. And then she was under like 8 different specialities at the time, so that's a lot of paediatric outpatient appointments. But when I first started, I was just anxious in between these appointments, and in the lead up I was just like, oh, I hope they give us an answer, I hope they do this and that. And like we never left with there is no answer, you know. But when I started doing lifestyle medicine, I felt like we were being proactive all the time. So that kind of anxiety about the future and like what could go wrong just quietened down. It wasn't like the most dominant thought or the dominant weight on my shoulders. I felt like, well, we're doing something proactive.
It gave you more control.
Yeah, it gave me that sense of control, so I didn't have that kind of health anxiety. And that's what I've noticed with patients as well. Like when they've got something they can do, they just feel like they are doing something positive, so they don't feel like just so disempowered.
So you were really sold on it then. You were a GP at the time,
yes,
I think, you?
Yeah, so I've always been a GP interested in preventative healthcare anyway, because that's obviously a big part of our practice. But it's more about how do you act, like, what does that actually look like? You know, they say, oh, 5 a day and exercise, but that's just boring, isn't it? Like, we don't want to hear that message anymore, really. But how do you actually do that when it wasn't that easy for me when I had 2 little ones and her with 8 different specialities and GP practice. So it's hard to put that stuff into practice when you've got life is tough.
So you started there. You're still a GP now. Can you just talk us through some of the stages and the journey you've taken to what you're doing now, I guess, Lisa?
Well, I guess so I found that, started implementing it with a family, and then 2 years later, so she was born in 2014, 2016, I then found the British Society of Lifestyle Medicine that started in the UK. It's been going on in America longer and in Europe. And they just happened to come to Cardiff for a conference. And I was like, this is my crowd, these are my people.
Yeah. Chance meeting.
Yeah. And like at the time, that first meeting, it was quite small. It was, one room of us. And I've literally just been in the annual conference this year that was down in Brighton that had like thousands of medics all over the UK.
Wow.
And people travel and come from abroad to learn all about this, and what's the latest science showing, how do you put it into practice. So like being involved in those conferences, you just get motivated from what other people are doing and how do they put it into practice. Like how in a 10-minute consultation can you possibly bring up lifestyle medicine? How do you sell it to someone without them thinking you're fobbing them off? Because that's often a big fear from the health professional side. And I think like I just started doing it in practice. So I'd like stay late and we do offer group sessions. Okay. And then I applied for lottery funding and partnered with the third sector service to do lifestyle medicine sessions where I talk about lifestyle medicine to the group, and we hired a cook to come and do a cooking session.
Excellent.
And a personal trainer to do an exercise session. So we'd do a quick exercise session for 20 minutes, we'd do a cooking thing, and I talk about lifestyle medicine while we learnt how to cook an evening meal plus breakfast plus
and this
lunch.
was free?
Free for the patients, yeah.
Great.
Yeah. So that was, when was that? So that was a good few years ago, but and then those patients nominated me for an RCGP like patient,
Congrats.
one of those award thingies. So not that that's what I was doing it for, but that was a nice surprise.
It's nice
So
to
we
get
sort of
validation
started
when you
there.
do something different, isn't it? To be fair.
Yeah.
Yeah.
But interestingly, like, so the patient loved it. I loved it. Third sector services, obviously, they loved it because, you know, you're working together with the same aim. But interestingly, like, a lot of other doctors weren't that happy that I was doing it. And I'd not really thought about that. I just thought, oh, let's just do it and like see how it goes, and like see what works. Yeah. But they were like, oh well, now you're offering something different, which, you know, we can't just scale that well. Not everyone can do it, and now you're raising people's expectations that everyone should be staying late. Yeah. And I had never really thought about that. I thought, oh, we're just doing it for the team, you know, like, you know, we're, you know, this just kind of shows this is the ethos of stuff we'd like to do. But so I wasn't prepared for that kind of negative backlash, I guess.
And what other things have doctors and people at NHS said about what you do? I mean, you were talking before we started the podcast, weren't you, about how people sometimes feel this is only something that works in kind of leafier suburbs or populations. Yeah. You got quite cross about that, I think, really, when I said that to you.
Yeah, really cross. Like, that is such a common thing that I hear, and I always get riled up about it, because I think that is coming from a place of judgment, where you're sitting across the table all high and mighty thinking, well, I could do it, but you couldn't do it. And like, we don't want that avocado culture of, oh, this is like for the middle class people. You know, I've never worked in like affluent areas, so, you know, yeah, maybe it is easier to bring it up there, and brilliant. Like, you know, those people need to get better as well.
You were in the Clontarf valleys before, weren't you?
Yeah, exactly.
You know,
yeah, so I've always worked. Yeah,
I think you'd like a challenge. It's fair to say, don't you?
Yeah. So I've always worked in the valleys, and now here in Newport, and you know, that is where it's needed. But you know, I think these days in Western life, we just don't have communities and towns that are built to support us to be well. You know, we just don't have that naturally. You know, so we don't have, you know, loads of space for cycling. It's just not the culture, you know. Whereas like some cities abroad, that is their culture, isn't it? Everyone's on bikes and moving all the time. And maybe it's weather, but I think it's town planning personally, that we just don't have that, because actually we have more green spaces per person, I think, in the UK than anywhere else. So actually, like, if you're thinking like green spaces, how great that is for health, why is it that we don't have way better health if we've got so much green spaces? Is it just
do you think that you know, maybe some of this is around things that we've always done things a certain way, so change is different and difficult?
Yeah, exactly. And you know, people are so busy, I think, that they just think, oh, it's just something else to think about. And if your mind is so busy, how can you get inspired to do things differently when you're just trying to survive?
Doesn't always feel achievable, I suppose.
No, and that's the kind of culture we've got in the NHS now, isn't it? It's like we're just trying to do the basics to keep people alive. And we think, well, actually, what we need to do is turn the tap off, and like, how do we change the course of this massive ship? Because at the minute it's sinking, and you know, you can pretend that we're doing everything to hold on, but are we really doing things to actually save things? We need to be much more vocal, I think, to say, if we want to save the NHS, it's because of this massive chronic disease problem that we've got, and dishing out more medicines and letting that become the normal culture is not right. Because, you know, have you heard, like, I've heard more than one 30-year-old say, well, I'm in my 30s now, so I don't expect to feel good. And like, how absurd that in the UK we've got 30-year-old people who don't expect to be able to jump out of bed and feel good.
Shocking.
It's crazy, isn't it?
It really is.
Yeah.
So you're obviously a bit of an agitator, it's fair to say, aren't you, Lisa? Which I think is what we need in the NHS.
I don't mind sharing my opinions of things.
And I think you've clearly taken a deliberate, alternative, very inspiring past. We're going to come later to some of your recent achievements. I know you've published a recent book, which is a huge achievement, so congratulations. But what other things you talked about in your initial GP practice? What are some of the things you kind of really seen have cut through and worked with this approach you've taken over the years?
Well, I guess one of the areas I managed to spotlight lifestyle medicine to, the bigger kind of powers that be that work in the NHS and Welsh Government was COVID. So in the COVID times, I was one of the lead for one of the field hospitals down in Bridgend, which ended up being really, really busy, one of the busiest in Europe. And like at the time, obviously, if you remember when COVID first came, like none of us knew anything about it. It was like brand new, and I was just like, well, all I know is lifestyle medicine. You know, we don't have any treatments for this at the time. We don't really know how it behaves. And I was like, I've been in this situation before, like thinking, like I've had to deal with something where there's no cure, you know, with my daughter, but this stuff did give me something to do. So I thought, well, maybe that's what we can do to help people recover, because surely it applies to most things. So we had a different model for our lifestyle, for our field hospital, which were to take people from the acute hospital once they started recovering and move them to the field hospital to continue their rehabilitation. So there, like, I managed to get lots of GPs in to help me and bring in the third sector, and we all kind of like created this ethos of let's use social prescribing, third sector services, what can we do to get people out of bed, and like bakeless cooking classes with the physios. Funny how many people were willing to get out of their beds to do a bit of movement, whereas before in the acute hospitals they didn't want to do their physio, or they felt too tired. But actually by doing things differently, you know, they did have more energy and they recovered a lot quicker and their care needs dropped. So that was a good opportunity to go, well, what this is lifestyle medicine. And a lot of people hadn't heard about it, you know, a lot of executives and, you know, important people with important jobs. So it was a good and you know, COVID had a lot of spotlight, didn't it? So it was easier for me, I guess, to get in front of the right people, to you know, carry on my ranting as I'm doing now, but to them. So, and then the Welsh Government obviously gave some funding to help with the waiting list problem then. So I obviously was like, I know a solution. You know, if you've got people on the waiting list, you know, as a GP, what I'm worried about is those people, yes, they might have their knee pain and need to see the orthopaedic surgeon, but while they're 2 years on the waiting list, they're deconditioning, now they're getting diabetes, now their mental health is going poor, they're developing ischemic heart disease, you know, catastrophizing. They're getting all these problems that are all linked. So then I kind of presented this idea of creating the Wellness Improvement Service, which is now still running in that health board. I'm not involved because I'm now in Newport, but that's still carrying on using the principles of lifestyle medicine, health coaching, third sector services, and empowering patients to improve their symptoms.
It's a hell of a legacy, absolutely.
Yeah. And now I'm in Newport, ready for the next plan.
I think the thing is, Lisa, actually, you know, my patients are often talking to me when I'm doing their chronic disease reviews at the practice. And I'll talk to them about diet and lifestyle, you know, and try and inspire. And one of the things that we've been talking quite a lot about recently, and we're seeing a lot of research coming out as well, is around healthy gut microbiome and things like that. What can you tell us a little bit about some of the stuff? Because there's a lot of information out there, isn't there, at the moment, which can be really quite confusing to be able to navigate for our patients and even for us as clinicians, really.
Yeah, like massive emerging field. And I think the whole gut health research is going to completely change how we practice medicine in the future. Because the more we're learning from that, the more we're understanding that actually the gut is in charge of so many different systems in the body. You have to think, like, we're made up of trillions of these little bugs. Like, we're more bugs than human. And when I think about that, I think, oh, what a fascinating thought. That,
indeed.
You know,
and scary.
And scary, yeah. Yeah, because you think, am I a human being or am I mainly bugs? But like, we're one whole ecosystem, and that is supposed to be a relationship where we benefit each other, and all these bugs are supposed to be there in harmony to help us feel good, but they can't do their job properly unless we look after them. And that's what the gut health research shows, really, is actually if we nourish these gut microbiome, they will nourish us back in all aspects of our health and mental health, importantly. So there's such a link between mind health, physical health, If you emotionally feel terrible, that's been shown to disrupt your gut microbiome. So if you're more stressed, so if you've got a really stressful life, that disrupts the balance of gut microbiome, so that you produce more inflammation, you're more prone to autoimmune problems, you're more prone to digestive symptoms, weight problems, mental health problems. But also, like, if you've got really poor gut health and you're eating the wrong things, then that can make you more prone to having depression and anxiety. So it's a real, like, two-way system. The research has also shown if you've got poor gut microbiome, you've got more pain. So, like, how many people do we know in chronic pain? Like, is actually the gut microbiome contributing to your pain condition? And I was in a fascinating talk with Professor Dean Harris, who's a colorectal surgeon in Wales, and he's really interested in like fecal microbiome transplants and how they could cure bowel conditions like ulcerative colitis and Crohn's, and that's his field. And in his research, he showed that if you have one course of antibiotics, it can disrupt your gut microbiome for up to 10 years.
Wow.
10
years.
Yeah, and they'll take at least a couple of years to rebuild it, and that's one course. Like, how
You don't
many
tell that to
people do we
patients,
know?
do we?
I don't think that's in the small print, is it?
So that's always my line now when
Yeah.
when I think about prescribing antibiotics, and just saying, like,
So that
you know, you
stewardship
really,
is
you've
something
really
we
got to
can
be careful with
push.
deciding on antibiotics because of this consequence. And often, like, people are really interested in that, and they have, especially if they've never heard of it before, and then they don't think, oh, they're just saying it's a virus because they don't want to give me antibiotics. You know, when you're saying, oh, actually, like, this is the bit of your body I'm really worried about, because if we wipe out this good gut microbiome, then your immunity is going to be affected, and then you're going to be more prone to these bugs. So, you know, let's make a really informed decision of balancing this risk.
Bit less medicine in some places.
Yeah.
Generally, I suppose.
Yeah, generally. You know, and not to be like, I'm not like anti-medicines.
Sure,
So, you know, that's the thing, is like there is such a space for a lot of these drugs that have made a massive difference. But it's not just thinking they're the main solution.
Yeah, and I think it's interesting because you'll see it in notes, won't you? You'll see patients' notes will say, think it's viral, and then they're given a course of antibiotics. It's interesting, isn't it? It's not antiviral at that point. You mentioned about making sure we feed that gut microbiome with the right foods and promoting that healthy gut microbiome.
Yeah.
If we think about ultra-processed foods, we know that wipes out your natural GLP-1 hormone or fullness hormone for anybody listening. How is that achievable, for example, in areas of deprivation where we know food is extremely expensive, people are struggling? Are there any things that you think or tips that you could give to anybody listening that would make it more achievable to get that healthy gut microbiome going and feeding that, I suppose?
Well, I think, like, the first tip really is to point out what the gut microbiome is and how it's there to look after you, and how actually they need looking after, need nourishing. And then the next thing is to really listen to what is their day-to-day life like. So, you know, in the last 24 hours, like, tell me quickly what you've eaten. Like, is that a typical day, or is that a better day? Is that a worse day? So you can kind of get an idea of where they're starting from. You know, it is really important to know, like, are you actually getting your food from a food bank, for example, or are you, like, doing a weekly shop for your family? Who else are you in charge of feeding? Because, you know, you can't put people on a, you know, restrictive diet if actually, like, they need to eat the same as 10 other people in their house, or, you know, they might have 3 neurodivergent kids who've got really restrictive diets. You know, you can't make things unachievable, otherwise they're so overwhelmed, they're more stressed then, thinking, I'm just harming myself even more. So finding out where the starting point is, and just slowing things down to go, right, you don't have to overhaul your whole diet, and you don't have to follow one particular diet. You know, all the research shows, particularly for weight management, the diet that works is the diet that you stick to. One is not better than the other, it's the one that you stick to. And the best overall diet is always going to be variety, and trying to limit ultra-processed food, and how do you get more colour. So I tend to simplify it and say, like, if we can focus on how can we get more different plants in your in your diet and more different colours, because plants count as like any fruit, any vegetables, like beans, grains, seeds, herbs, and they all count and they all add up. And actually the research shows if you've got 30 per week, that's the best for your gut health. So if you've got 30 points, that's always going to be better. And you can add that up quite quickly in like chilies or curries or soups or stews. You can just add so many different spices in, and often if you get those, they tend to be a bit cheaper. Like freezer, so if you've got like frozen veg, they're just as good as fresh veg. That's cheaper, and often like a bit easier if you're just piling everything into like one pot things, and then you can feed more of the family. You know, you can blend all of this stuff, so if you're like worried that, oh, my kids will never eat all of that veg and I'll just be wasting money, you can just blend it into a sauce. And yes, you're not getting as much fibre if you don't have like the skins of the veg, but you're still getting a lot of nutrients into your kids and getting that taste developed, so you know they can just develop the taste for it later on then. So it's just little tips like that, but mainly it's to say, what one thing could you do this week? Or have you ever thought, is there a time in your life where you felt better about the stuff that you were eating? You know, and what was it then? And what helped you then to stick to that? You know, what was it in your routine that allowed you to do that? Or, you know, thinking about what's your shopping plan, or, you know, so you have to meet people where they're at.
Yeah.
And think, you don't have to solve it all in one appointment. You're just responsible for planting the seed, is kind of the way I look at it. So I don't feel like really overwhelmed that I need to like sort out all of their life issues. It's more about, I'm going to plant the seed. You know, they can come back to me if they're interested in carrying this on, or you know, they can Google it then, can't they, and go, oh, that doctor really said that there was loads that I could do. I'll look into this.
Are there any resources that you would particularly signpost people to, or would you just say that general Google search?
Not
is
really,
great
because
just to
I
kind
do a
go
lot
out
of
there?
chat, so I don't want to then kind of overwhelm them by going, look at this website,
Sure.
look at this website, look at this website. I tend to say, just have a think about what is most important to you, and what one change could actually make a difference to you this week. Yeah. And let them kind of build on that.
And I suppose it's that empowering, essentially, isn't it? Go out there and find that stuff.
Yeah.
You know, as you say, planting that seed. I think that's great. I really do. I think that's absolutely brilliant. A lot of patients will ask me about kefir. This is a big thing that a lot of people are asking me about right now. They sell it in the supermarkets. Unfortunately, some of these kefirs that are on the shelves are full of additional stuff that's nasty that we don't need. What are your thoughts around the kefir and stuff like that in terms of that?
Well, I take it, so I'm a fan of it, but like natural. So it.
Do you make it yourself?
No.
Do you not? My wife does.
No.
So we're a big fan of kefir in our house.
Yeah.
Very
it doesn't taste nice, does it? But
I quite like it.
But I was going to say, I've drunk it enough now, so that it's not like the worst thing.
Yeah.
But I like force my kids to have it, bless them. So they have it as like their like daily challenge of who can do it without like pulling a face.
You'll thank your mum one day.
Yeah, it's like you'll thank me.
You will do. Yeah, it might be a while, but you'll thank her one day.
So I feel like that I'm like sort of half prepping them for like uni life, because they have them in shot glasses and then shot them back and think, I'm not sure if this is appropriate or not. But, you know, they're enjoying their daily shot. So, you know, probiotics. There is a bit of evidence for that. I mean, it's much better. The better evidence is for 30 plants a week and that variety, because actually if you feed them, they naturally like come back. But you know, it's an easy way to top it up. The problem with supermarket ones is that some of them don't. It'll say like 4 billion strains, and you think, oh, that's good, but actually it's just the one bug, but 4 billion of them or whatever. Whereas actually what you want is variety. Yeah. So I don't tend to like recommend the big brands in the supermarket. And there is a really good Welsh company that makes kefir down in West Wales. So
there is indeed.
Yeah, so that's what I have, because I think, well, this is natural. I know where it comes from.
We should have gotten to sponsor this podcast now.
Indeed, we should. So if you do see this, then please get in touch.
Yeah.
I just wonder. You mentioned before the 10-minute consultation. I bet you've thought before with some of the people brought into these different services, if you could have your way and run your own GP practice, so your own clinic, with an unlimited supply of other staff, who would you bring in?
Who would I bring in? Oh, this is a good question. I would bring in a health coach, who's trained in like motivational interviewing and behavioural science, so they can actually help patients to change their perspective and realise how they can do it. So that would be one of my key people. I would also have a clinical psychologist.
Interesting.
Because so many patients that I've seen here have got such big traumas in their past.
Yeah, we don't realise sometimes.
You don't realise, no, unless you start. And this is the interesting bit about lifestyle medicine, because you start asking about their life, and this stuff just comes out.
We're just engaging up here, aren't we? And there's all this kind of stuff.
And you think,
beneath,
oh well, there's no point.
Yeah, wish I'd known that.
Yeah, exactly. Yeah, so clinical psychologist to help them process a lot of their trauma or adverse childhood events. I think like having that is absolutely key. GP, obviously. A practice nurse, obviously.
Thank you very much.
You need those. And probably like personal trainers to do like how can you do strength training and make it manageable with the stuff that you like doing, because not everyone likes going to the gym. Like I'm not a massive fan of going to the gym, but I need to do like strength-based exercise. So how do you do strength-based exercise in your own environment that you're comfortable in? Who else would I have? It's obviously like my receptionists are fantastic. Could do anything without my receptionist or the practice manager. But who else in the clinical? Who else in the clinic? I think someone who can do all of those pillars, and then like mainly it's like people with the right attitude.
Yeah.
Who all are from the same ethos of
passion.
Like anyone can do anything, and not just constantly say, oh well, that person's never going to change.
Optimists, people that want the best.
Yeah.
They can see the best happening.
Yeah. Because you never know when someone is ready to hear it.
True. Yeah.
And that's the thing, is like I'm always like, oh, I've probably mentioned this before, but I'm just going to say it again, because it is all about just planting that seed and just watering it from then on. So I think if everyone says the same message, then I think that's when you're more likely to get results. And like not everyone wants. How many people do we see that don't want to get better? And that's fine. But I think there's less of those than we think.
I think the thing is as well, that what was interesting from what you're saying, that I've certainly tried to build into my practice, is that you don't need to achieve all of these things all in one go.
No.
You don't need to do everything. Just pick one thing. And I think that makes it a bit more achievable, doesn't it? Because it can feel like a mountain to people when they're going to make some big lifestyle changes. And then that's easy to then give that up, isn't it? And not follow through with it.
So people just get overwhelmed, and they just don't hear you then. They just think, okay, I'll do that. I'll try and exercise and eat.
Starts Monday.
Next
Monday.
And they just think, and then they just think, well, that person has no idea about my life or the things that I've got to manage at home. Like, you don't realise. So I think the most important thing is just opening that space up of saying, like, what makes you feel better? Well, what have you thought might make you feel better?
Yeah.
And they often will come up with an idea, and you can then go, oh, well, did you know that is part of lifestyle medicine, actually? Like, there's loads of research to show that helps. And then they get a bit more confident then, and going, and like, interestingly, people will then say, oh yeah, and this often makes me feel better.
Yeah.
So I think it's all about just making sure that you're not constantly taking the power away from your patients by going, this is what actually helps. So like whenever I prescribe antidepressants, I always say, now just remember, now this is not the only thing that's going to make you feel better. Don't put all the power now that you feel better just because of this medicine, because it's probably you're going to feel this is going to get the ball rolling, and then you'll start going out, or you'll start meeting your friend, and that has equal weight. So look at the little things that you're doing.
I presume, though, in terms of if we go towards the training side of things, that certainly in medical training, the amount of nutritional training that is quite small, from my understanding. I know in nursing it is absolutely a very small part of our curriculum. I'm presuming you would be an advocate for this being introduced and included within doctors' training, certainly, and within GP practices, so that then people were starting on the right foot.
Yeah, absolutely. And like, yeah, interestingly, you know, I've had like run-ins with dietitians before talking about lifestyle, talking about lifestyle medicine, because they will say, yeah, but we're the experts in diet. No one else should be talking about diet. And I think, yeah, that's great. It's great to have specialists in specialist areas, but a huge amount of contact with the NHS is for the basics, and it's the basics that have been ignored, because we're all thinking, well, it's someone else's job, it's public health job, or the school should be doing it. But actually it's everyone's responsibility, and what we need to do is focus on the foundations. Then we can get more niche with the specialist advice. And if the basics aren't working, then maybe they do need to see a dietitian, you know, rather than anyone who's got poor gut health all should go to them because they're not tolerating any of their food. Like, I think like a massive cohort of people who see dietitians probably have got lifestyle induced IBS because of our current diet. And actually, like, maybe if we improve that, a lot of those symptoms will disappear.
Yeah, and of course we've not always learned together at the beginning, really, so we don't always work together at the end, really, do we? And I think there's lots of aspects of our training that needs to be shaped up to make us think preventatively, but we've got a very referral based system when we need a relationship based system. And actually if we had more people closer together in a neighbourhood team, you could actually learn from each other. So you'd be sending the people that need to see a dietitian for that specialist opinion, that really need it, as opposed to going, I'm just going to send a referral and you won't come back to see me again, really, which isn't really helping anybody. All the time.
And they don't feel any better either, and I think then that's when we're all disheartened and thinking, I just feel burnt out, because you know, you went into the job to like make a difference and help people, and then if you don't leave work at the end of the day thinking, I really did make a difference to that person, you know, it's just not what you went in. It's just more stressful, isn't it?
Well, I can see the potential for that clinic. I can see you running it there one day. If anybody out there who's an educational psychologist or a health coach, you know, speak to Lisa.
Who would you have
speak
in
to
your
Lisa.
clinic?
Oh, it'd be very big. Really wouldn't it? Too big for us to list on this podcast. But I was really interested to kind of come to your book, which you've published quite recently, I think, really. So this has been a journey you've been on. You're a really passionate advocate. Yeah. So tell us what motivated you to want to write this book, and what some highlights of it might be.
I think because like one of the things that often I speak to with colleagues about lifestyle medicine is it's so difficult to get it into a 10-minute consultation, and you know, how can people do it? And where I've always worked, you know, people do have really tough lives, so it's not that easy. You know, they're not at home with a health club that they can go to willy-nilly. So how can you do it without getting completely overwhelmed? And I remember when I first started overhauling our life because of my daughter, it was so overwhelming, because I really looked at everything like, oh my gosh, everything, and you go on the online world and everything's toxic, and you think, what's toxic? What does that mean? And I remember being in a supermarket looking around thinking, oh my gosh, everything here is ultra processed. What is healthy? And you know, I read this that said like an apple is brilliant, and then I read this that said an apple is terrible for you. You can read anything that's
there's no single
contradicts itself. And I remember thinking, oh my god, if I know a lot about this stuff and I'm overwhelmed in the supermarket thinking everything around us is poisonous and we're all dying. You know, how can anyone else do it? So it was since then that I thought, right, you know, calm down. Just go back to the basics, one day at a time. What can you do today? So that's how I wrote it, is to kind of introduce what lifestyle medicine is, you know, the background for it for me, what are those pillars of lifestyle medicine, and what are examples that you can do to improve your sleep, your nutrition, your exercise, your relationships. So I've put like examples in there. And then in lifestyle medicine, we prescribe a lifestyle medicine. So we've kind of tried to mimic it to you know, Western medicine. So if you think you're prescribing paracetamol, for example, you put down what the drug is, how you're going to take it, when you're going to take it. And that's what we do with lifestyle medicine. What are you going to do? When are you going to do it? How are you going to do it? So exactly the same thing. And you break it down to as basic as that. What one thing are you going to do? How are you going to do it? When are you going to do it? So you kind of think of like what hurdles might get in the way. So it's a book about that, really. It's a journal for 3 months of what lifestyle medicine prescription could you create for yourself that helps you commit to that one action a day. And those little actions, they mount up and have a measurable effect. And it just makes you think, oh, actually, I did do something. Or sometimes it's just noticing, I did do something for my health today, instead of thinking every day, oh, I've had a bad day today, I've not eaten what I wanted, or I've had too many coffees. But actually, like, did you spend more time with your friends? And actually, well, that was a boost to my health, because socialising and being around people, you know, that adds years to my life. So it's not about, oh, I haven't done all the sleep and all the exercise and all the nutrition all in one go. So it's just about thinking, oh, actually, and noticing I did do something positive for my health. And the more times you think, oh yeah, I am healthy, you get into that mindset of I'm more healthy than unwell.
And it's not been out all that long, I don't think,
So,
but what's the response has been so far, do you think?
I think it was, July time now, I'm trying to think. I don't know, every week rolls into one, isn't it? So July time, and like some of the patients I know that follow me on social media anyway, they've got it and they've said, oh, this really makes it so doable, and I get what you say now, and I get the fact that I'm doing more than I thought. And like one of them said, I don't feel so defined by my health conditions now, because this doesn't focus on health conditions. You know, it doesn't focus on the negatives, it focuses on the positives, and it helps you kind of enjoy your life. So I think that's what, you know, one of the patients said is, now I've got space to actually live and not just think I'm just this chronically unwell patient and that's what defines my life.
Is there a significance behind the 3 months, or is this just a good number, really?
No, just to kind of get into the swing of it.
Like a reset.
Really. Yeah.
Okay.
So, no more clever thinking than
Fine.
that, really.
I thought I'd ask.
But I think it does take time, doesn't it? And I think, like, from behavioural science, a lot of the research shows that if you do something for 8 to 12 weeks, that's when things get a bit easier and you kind of get into the swing of things.
So it was kind of a science behind it.
It's sort of science, not my science, yeah. So that's gone down really well. My calm belly method course, that's gone down really well. So I've managed to make a big difference to a lot of people I know who've had significant digestive symptoms of, you know, IBS and things. So that's been quite a positive move as well, where, you know, people find that actually, like, following the course and doing my like belly meditation. So I write meditations for health conditions on my YouTube channel, and I've written like specific ones for a 6 week block that change every week, and that's been, you know, they found that really helpful. So far so good.
Lots happened.
I'm on a mission.
So all of that is on YouTube, and we'll put the links into this video, so if you're interested.
So there's just so much to do, isn't there? But I find it motivates me and energizes me in the NHS world, where you know you can get really burnt out by it, but it just brings that art of medicine back, I think, of, you know, how medicine used to be. You know, we used to help people where they were with what they've got, and it's just bringing that back, really.
And equally, we'll mention the links to your book, but if anyone's listening to Spotify, it's called...
The book is called Your Lifestyle Medicine Journal.
And it's available on
Amazon. So it'll be sent to your house. And or my website is www.drlisate.com.
Thank you.
So,
Well, before we start to wrap up, Lisa, I just was interested, you know, you've done so much. I know it feels like a long period of time, but you've really condensed a lot in, it's fair to say, really, haven't you?
And I've had a baby 17 months ago.
Wow. I can't say much more, really, can I?
Absolutely.
What are you
I should
hoping
mention
to
I've
do?
got more kids as well, because otherwise they're going to be like, why did you mention the baby? Us as well. My husband and I got 5 kids between us, so yeah, we're a busy family.
Indeed.
Well, what do you hope to see next? What do you hope to have on the horizon?
Well, I hope so. There's a policy in Welsh Government called the 3Ps policy, which is prevent, promote, prepare. And in that policy, it mentions lifestyle medicine. Like, I don't know who put it in there, but who encouraged them to add it there. But the policy is supposed to encourage all health boards to have this kind of ethos of offering this for patients to help them on waiting lists or people preparing for surgery. So I'm kind of hoping that the future is going to be, this is like routine for everyone. Everyone's got access to it. And it doesn't become a kind of wellness movement for the elite and the middle class, and then we get more inequality. You know, that's not what we want. We want to use this to reduce that inequality that we see. So my hope is that like we all start just talking from the same hymn sheet. But like maybe it's quite green, but
Well, no, I think that's a great hope to end on, isn't it? Well,
yeah, why not?
a huge thank you, Lisa, for joining
No
us.
problem.
It's been an
Nice to
absolute
chat.
pleasure and an inspiration, and I'm sure you've
Yeah.
inspired many people up until now listening today. Thanks to our listeners and viewers for coming to this 90 Nails podcast, and for Dan for hosting us for the
Indeed.
first time in this place.
Yeah.
If you've got any ideas for podcasts, you'd like to suggest a topic, or if you're interested to come on to our podcast here or a venue elsewhere in Newport, then get in contact at info@19hills.org. We look forward to following up what happens with you in the future, Lisa, and many thanks once again.
Thank you.
Take care.
Bye.